Hello, viewers. Welcome once again. My name is Pius, and this is your Let's Talk Health on DS Online TV, where you have all your information related to health. Today, we're going to delve into another very important topic, cervical cancer. It's something that our mothers, women in general, those who are prone to the virus that causes that battle with in their life. Today, we have with us a gentleman who has 15 years of experience down his sleeve. He is a health promotion officer at the 𝐂𝐄𝐲 Municipal Health Directorate. Ladies and gentlemen, he's not that person, but Mr. William Ameke. He's going to help us digest this important topic. Sir, you're welcome.
Thank you, sir.
How's your day?
Actually, it's so stressful, but you cannot complain.
Yeah, I understand. With the health sector there's a lot of work over there.
Yeah.
Okay, today we want to actually delve into this very important topic, cervical cancer. What is that, and what can you tell us about cervical cancer?
Okay, first of all, let me use this opportunity to say a good evening to all viewers, wherever they're hearing us from.
It could be good day.
Yes, wherever they're hearing us from.
Yeah, and anytime they view
watching
it.
us also.
Great.
In actual fact, health is wealth.
Yes.
And the topic we are coming to talk about this evening is one of the crucial issues which is affecting most of our women in Ghana, or I may also say globally.
Okay.
Yeah.
When you say that, you are pushing me to ask a question. Do you have any statistics with that, or you get us that later?
There's no specific statistic I can bring out now.
Okay.
But cervical cancer is one of the second leading cause of cancers and cancer-related death.
Wow.
Among women.
Wow.
Globally.
Wow, that's
and
serious.
In Ghana, it's the second leading cause of cancer-related deaths among women in Ghana.
Whoa.
So WHO is trying very hard in order to support each other partners so that by the year 2030, we'll eliminate, if not zero, at least to the barest minimum by the year 2030.
2030 is just 5 years from now.
Oh, yeah.
Okay. So can you tell us what causes cervical cancer?
Oh, okay. We cannot talk about cervical cancer without looking at what we call HPV. In other words, human papilloma virus.
Okay.
If we say human papilloma virus is one of the most commonest sexually transmitted infections.
One of the most commonest sexually transmitted infections.
Yeah.
Wow.
And is responsible for causing other cancers as well.
Tell me more.
One is cervical cancer.
Okay.
Anal cancer, throat cancer, vagina cancer, penile cancer, and what have you.
Hey, today is my first time hearing about penile cancer. That's the cancer of the penis.
Exactly.
Hey, this is serious. Wow. So what is sexually transmitted? Okay, I wanted to ask what is sexually transmitted during the truth, but I just remember people have oral sex too.
The reason why you say throat cancer is, some people, they also have oral sex. So in course of the act, if you don't know the person is carrying the virus, you use your tongue, you use your mouth, you are picking a whole lot of things into your mouth.
Sorry, now the BJ there, you are spoiling the market too.
I'm not spoiling the market, but rather they have to be cautious. And the other thing I'll caution viewers also is the right channel is supposed to be passed through. Let me leave it there like that.
We should use the right channel, not no BJ. That one too.
No, don't go behind.
Just go where you have to go to. Okay.
Even going to the appropriate channel too, you have to go there with caution. You have to protect yourself.
That is if the person is not your wife. That's how I have to put it. Because
exactly. Even if she is your wife, he is your husband, you must be faithful to that person.
Okay.
Because you realize that people with multiple sexual partners easily pick some of these sexually transmitted infections from others and transmit it to others as well.
Wow.
Yep.
Wow.
So basically, human papilloma virus is what causes other type of cancers I talked about.
Okay, but I would want us to go back to this very question, cervical cancer.
Yeah.
What exactly is that particular cancer?
Okay. When we talk about cancer, the simplest term is abnormal growth of cells.
Okay.
Cancer.
Okay.
Abnormal growth of cells.
Okay.
So we have various forms of cancers.
Okay.
Prostate cancer, breast cancer, and the one we are talking about now, and other cancers you can talk about.
Okay.
Now, when we come to cervical cancer, it pertains to women.
Okay.
You know, the opening of the uterus, joining the vagina,
Okay.
that portion alone is a cervix.
Okay, so that is where the vagina meets the uterus. That
Exactly.
particular point is the cervix.
Exactly.
Okay.
So the cells around the cervix, if they grow abnormally, the way they're supposed to grow, the way they're supposed to, let me use the word, they're supposed to grow, and something untoward happen.
Okay.
Maybe either the size or some other things happening there.
Okay.
Then we look at few signs and symptoms which will be delving into soon.
Okay.
Then, but before you can conclude that you have cervical cancer, you must be screened.
Okay.
Go through appropriate screening process.
Okay.
Then, if the result is A, then we know what exactly to do.
Okay.
Yep.
So if that is what is causing it, can you give us some signs and symptoms of cervical cancer? Yes, so that is it possible that one can see and tell that, okay, this is cervical cancer? What are the signs and symptoms of that?
When we talk about cervical cancer, the signs and symptoms we'll be looking at, let me caution viewers, you cannot pick one and conclude unless laboratory investigation.
Okay.
However, if you're infected with this, one, there will be offensive vaginal discharge. Offensive vaginal discharge.
Offensive.
The scent will be so strong to the extent that you cannot even stay among public. The person cannot stay in this room. And you cannot stay around the person.
But I think it's down there. When we part, won't you cover it a little?
You cover it all right, but
the stench is just too much.
It will drive those around the person away.
How is the smell like? Because in one of our studies, we in one of our presentation, Dr. Victor was here and told us about some fishy smell when we're talking about vaginal discharges. So this one, how is the smell like? How foul is it? That smell, how is it like?
Let me use it.
Can you liken it to something?
The most offensive odor you can ever imagine on this planet Earth. And because of the scent alone, the stigma associated with this, that's why most people, even if they started showing these signs and symptoms, you realize that they will not even open their mouth and tell you, I'm having A, I'm having B.
Okay.
Because of the stigma.
Okay.
They feel shy to the extent that there's nothing they will talk about it. Because society or the group in which they are rejected.
Wow.
Apart from that, the person also bleed in between her menses.
Bleed in between menses?
Yes.
So assuming the person has a 28-day cycle,
exactly,
it might be some bleeding in between, maybe 10 days, 14 days, exactly, there'll be some bleeding.
Yes.
Would the ovulation also still flow normal, or it alters the cycle entirely?
You realize that the usual 28 days will now be confusing the person.
Okay.
So she can no longer pinpoint when the menses end and when it will start. So in this regard, if you realize that you are bleeding in between menses, don't sit at home. Don't go to drugstore and buy any medicine. The best thing is you go to hospital, seek for medical attention as early as possible.
Okay. So what other symptom or sign do we have again?
We also talk about what we call dyspareunia.
This what? Dyspareunia.
In a simplest term, let me go this way.
Yes.
In a simplest term, painful sexual intercourse.
Okay.
Dyspareunia.
Okay.
Painful sexual intercourse, which under normal circumstances, the person shouldn't be having that pain during sexual intercourse.
But bro, we for what we've been hearing, we understand that ladies always make noise. Ajay, Anya family, Ajay is paining.
Some I don't want to go there.
Oh, please feel free, go there.
They are just trying to
adding some sound,
some spices to whatever is taking place.
Okay, so all those Ajay is just making it more romantic and making you feel good.
It may give you two different meaning.
Okay.
Either there's pain there or the person is enjoying it.
So you yourself as a female, when it's painful, you would know that this is painful.
You will know.
It is not your usual enjoyment where you have your morning and all those things.
Never.
Okay, so it is painful.
Yeah.
Okay.
Painful sexual intercourse. And also if probably you are no longer menstruating, in other words, you are in your menopause, but along the line you realize that you are bleeding.
So you
bleeding, that's post-menopausal bleeding.
Okay.
You know that your menses are ceased for some time now.
Okay.
Naturally. But because of this infection, bleeding also coming along the line. Nobody should be confused about this.
Okay.
That, my menses that has stopped for almost 3 years has resumed again. I am now fertile. No. Something is happening there.
Okay.
Yes.
So you don't just stand and start shouting, hallelujah, God has answered my prayers.
Never.
Okay.
You cannot.
You should go to the hospital, get it checked. I like what's our prophet of now, some do. They ask you to bring a medical report showing that this is really a miracle. So in this case, when you are seeing a flu, after you have a cut in your menstruation, you should go to the hospital, get it checked, and be sure that this is a miracle and or not the other way around.
Yes.
Okay, so is there any other one add to it for us?
For now, for the sake of time, I'll leave it with those for this and for now.
Okay.
However, if you see 1, 2, 3 of these signs and symptoms, please go to hospital. Don't conclude at home and say, I'm having cervical cancer. No, it could be other conditions.
Okay.
It might not be cervical cancer.
Okay.
So the earlier the person reports for treatment, the better.
So that means it can be treated.
Oh, yes.
So
if the person reports early, enough.
Okay.
Because one thing about cervical cancer is treatment is very expensive, my brother. The vaccine is very expensive. And if it reaches the advanced stage, sincerely speaking, there's nothing they could do that some other treatment only support you for some time. If luck is not on your side, let me use it. If luck is not on her side, something untoward will happen.
Okay, so this quickly brings me to a treatment. How can we manage? Is it managed or is it treated? Can one get it out entirely? How do you get your way that you don't get infected? Or how do you treat it? I want to put the two of them together.
Oh, okay. In other words, we are looking at the preventive measures.
Yes, let's look at preventive and then we dovetail with the treatment as well.
Over here, the best thing is you're faithful to your partner. Don't flirt from here and go there.
Okay.
And 2, make sure you are vaccinated with HPV vaccine against this virus.
We'll get to that vaccination because I know this is the era.
It's part of the preventive measures.
Okay.
And 3, the person should make sure that she's screened.
You get screened.
Yes. Get to hospital. And this one is done at Battle.
Only in Battle?
Yes.
It's not
with
done.
To the best of my knowledge.
That's to the best of your knowledge.
If they should roll it to other hospitals, maybe it's in the process.
So
but what I know very well is Battle
Government Hospital. Well. They do the screening.
Exactly.
Oh, okay.
And also the treatment as well.
Okay. So now quickly talk about the treatment too.
The treatment is about this. You go for vaccination as early as possible.
Okay.
So if you are screened, you are not having the virus, then you take the vaccine.
Okay.
The human papilloma
virus vaccine. Okay.
So that it will protect you against this. However, after taking the vaccine, it does not mean that you are protected against other sexually transmitted infections. Somebody may think that after taking the HPV vaccine, I'm good to go. Even though we are
range.
saying it's sexually transmitted.
Yes.
But the vaccine does not protect an individual against syphilis, gonorrhea, HIV/AIDS, and other sexually transmitted infections we can talk about.
So basically speaking, the vaccination, HPV vaccination, is not a broad spectrum vaccine that prevents all sexually transmitted diseases.
It protects the person against this cervical cancer.
Just is it cervical cancer or the whole of HPV? Because I know there are strains of the HPV virus.
Yes, we have type 6,
okay,
11, 16,
okay,
and 18.
That's 4 strains of the HPV.
Exactly.
So the vaccination, I don't want to jump there quickly, but okay, we're already there. So the vaccine, when you take the vaccine that you are rolling now, does it protect you against all the strains of the HPV?
Thank you. With that one, it depends on the type of the vaccine you are given. We have Gardasil 4 and Gardasil 9.
Gardasil.
Let's take it like that.
It sounds like one of my senior man's name back in secondary school, Gardasil. Gardasil.
With these 2,
okay,
they protect against all the strains. The most powerful, I don't want to put weight or value on anyone.
Yes, leave it like that.
They come with the prices.
Okay.
It's like a different manufacturer will produce this dress and somebody will sell it, let's say 100 cedis.
Okay.
Another company will produce the same thing.
Okay.
And then they will sell it, let's say 80 Ghana.
It also depends from the country of origin, depends on the materials used in producing. So
with Gardasil 4, it protects against 16 and then the 18. But Gardasil 9 covers all.
Okay.
Covers all.
Okay, before I go there, now tell us basically the Ghana Health Service, we understand you are rolling out a project. There's something underway and you are giving the vaccination. Tell us about that activity. We want to understand what activity is there. Is it for everybody? Can I also go there and get the jab, whether it's a jab or it's a droplet on the tongue, or they drop it in your ear so that your brain will begin to work well? Or what is it really about?
Thank you so much. Actually, Ghana Health Service and other partners, they put these measures in place. We cannot roll out a World Health Organization.
Okay.
Actually, we also partner with GES.
Oh.
The reason is the target audience we are looking at this time. They are our girls 9 years to 14.
Why 9 to 14?
Thank you. The reason is at this prime stage, we want to boost their immune system against this particular, let me use the word, deadly disease.
Senior, hold on. Are you presuming that the kids between 9 and 14 are not sexually active and that is why you are ruling it out for just that session? Is that what the assumption is?
No. If you look at the prevalent rate of cervical cancer, it affects 99% of women.
99?
Yes. For that matter, we want to tackle it at this prime age. So if a chunk of them are being vaccinated, you realize that in the near future, by the time we get to 2030, at least the rate at which the disease is escalating, it will be minimal.
Will be curtailed. But
yes.
My question again is this. You made it clear in your presentation that you get tested or checked. Screened is the word you use. And when you are found not to have the virus, then you are vaccinated against it. And now I'm asking that, okay, are you screening these people before you are vaccinating them? Or it is just premised on that assumption that these people are innocent and for that matter, you are vaccinating them?
Yes, at this prime age, we believe.
You believe?
We believe they've not been exposed. We don't want to use sex as a cutoff point. But rather, our main target is how to eliminate cervical cancer in the system.
Oh, I agreed. Where I'm trying to get it clear is this.
Yeah.
Now, if these people, some of them are already sexually active, I'm speaking from a point where I have actually seen.
I don't dispute that idea you are bringing out.
So if these people, some of them are sexually active, in case somebody already has the HPV, which we are not expecting, but if that is the rate, 99% of women, if any of these age grouping that you are looking at is already with the virus, when you give that vaccine to that person, won't it cause anything to the person?
Thank you. It will not, because in 2013 and 15, 3 regions had opportunity whereby the HPV vaccine was piloted.
Okay.
And after everything, the findings were very positive. Let me use the word.
Okay.
And looking at the same age group we are talking about now.
Okay.
That's why we are trying to at least continue with the same thing in all the 16 regions, at least with the aim of hitting the targets before 2030.
Okay, so please permit me, I'll be asking a lot of questions because our time is limited.
Yeah.
Again, are we targeting only female or male? Because if 99% of women are having this virus, this virus, then where are they getting it from? Obviously, it's from the male.
Yes.
So are we vaccinating only female, leaving the boy child, like how we did some years back in the early 2000s? Send your girl child to school and the boys are not going to school, and for that matter, they are not getting the necessary attention. Are we doing the same in this case?
Yes, we are vaccinating only girls.
Hey, Charlie, for not being fair to us.
I must also add that it's a program.
Okay.
So if we say 99, meaning the 1% is somewhere.
Okay.
Definitely, the girl alone cannot get it, or the woman alone cannot get it if there's no sexual affairs.
Okay, great.
So with time, I believe the ministry will also make plan for the boys and also the other age group you asked of. At least they will look at them also.
Oh, wow.
Because the other reason is the vaccine is very expensive, my brother.
Okay.
Getting a vial alone, it will be very difficult if you are not financially sound.
So is the count, permit me to ask a question that probably you may not have answered to. Don't mind me. Is it that the Ghana government is paying for it or they are giving to us for free?
Okay, that particular question, the answer may not come now because we are supported by the Ghana Health Service to roll out this particular exercise. Whether it's a donor something, I don't want to
delve into that.
Yeah, delve into that now.
No problem.
But what we are told, the vaccine as individual, if you are to purchase it and then use it, it's expensive.
Okay.
So they are trying to see, with this cutoff point, where are we? Where should we reach before 2030?
Okay, that's beautiful.
Then we see the other plan they also make for the other age group also.
Oh, okay.
Likewise, the boys.
Yes, because it's very, very, very necessary. Yeah. Okay, so it's quite challenging. So we have this particular vaccination or is targeted at girls between the ages of 9 and 14.
Yes.
So you are partnering with GS because these people
get them in schools.
You get them
and also
in schools.
We call it in school and out of school.
Okay. So is it a jab you're taking on the shoulder?
Yes. It's an injection on your left shoulder.
On the left shoulder?
Yes.
Okay.
At an angle of 90.
So is there any identity that one will bear that tells that the person
actually, we may not mark the finger, but there will be a provision made for a yellow card. And that yellow card does not contain only HPV vaccine. Other vaccines are also stated.
We have thrown those cards away.
No. Currently, with the vaccination now,
yes,
there will be another one provided given to this
Ghana Health Service. You have been giving us yellow card.
Yes.
We take yellow fever, we throw away. We take COVID, we throw it away. So you are just giving us yellow card.
Thank you. I will urge us all to take care of those cards very well because you don't know what they request for in the near future.
Hey.
Whether it's 111, please Keep it well. You will need it one day.
Okay. So what of those who have that myth? People say, they sang a song, Corona never Corona. People are telling us today that they didn't take the jab. Now they are better. And they are feeling free. They have not taken the jab. That's one. People have this saying also that these white men are trying to slow down the black man race.
The growth rates.
Yes, and for that matter, they are giving us this, and they are hidden causes to it. We have also heard about people complain that when they took the corona vaccine, and this happened and this happened.
They to alter their DNA.
Yes, has done that.
We have no longer be active as man.
We had a lot of stories. So are you not? This one is not going to sterilize our women that they will not be able to conceive and have children in the future.
There's nothing proving that after taking this vaccine, the girl cannot give birth.
Okay.
Nothing.
Okay.
These are some of the myths and misconceptions.
Okay.
Which we are trying to at least do away with in the public domain. The vaccine has nothing to do with fertility. Absolutely nothing.
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 We should believe it so.
We should believe it. The fact is, as I said early on, over 10 years, it has been proved and tested.
In Ghana here?
Oh, in Ghana.
So this
is what I talk about when the piloting started in 2013 and 2015.
Okay.
Greater Accra and then Northern Region. The other three, I could not record the name now.
Okay.
Yes. So if it were to affect their fertility, out of the first rollout.
How many years back?
10 years plus.
10 years plus.
So at least.
And all these people are still giving birth.
Something should have popped up.
Okay.
After the research and whatever. Then they say, the vaccine, it will affect the women. They will no longer give birth. Then they will know how to hold on.
Oh, okay.
But as at now, they are all good news.
Okay, so thank you so much. Our time is fast spent. We're trying as much as possible to keep within time.
Yep.
Mr. William 𝐂𝐿𝐴, if you have any last few words for our viewers, with your camera, you can look straight into the camera and tell them what you have to tell them. If you have to encourage them to go for the vaccine so that the virus, HPV, and then the cervical cancer, we can really curb that, that we can be free in the future. If you have anything to tell to the younger generation, please feel free. Look straight into the camera. That's yours and tell them.
Thank you so much.
Yeah.
I must say that cervical cancer is treatable, is preventable if you report early enough. So please, as we start the campaign today, starting it will end on Sunday. That will be the 12th of October. Please allow your girl child to be vaccinated so that we can put an end to this cervical cancer. Please, with regards to all the signs and symptoms I talk about, report for screening, seek early treatment so that cervical cancer at least will be a thing of the past in our country. Thank you for your attention.
Thank you so much, Mr. 𝐂𝐿𝐴 William from the Ghana Health Service. That's the Health Directorate in right there in 𝐂𝐻𝐻, the 𝐂𝐻𝐻 municipality. And he took us through cervical cancer and all the job they've been doing, all the work Ghana Health Service has been doing in relation to this particular virus. So get screened if you're an adult and do all the needful he has mentioned so that we can have a free generation that's taking the vaccine. Let your girl child take the vaccine so we can have a free generation going forward from the year 2030 as they have estimated. Viewers, it's been your health segment and the name is Pius. I've been your host for this section. See you.
Thank you.